Seed cycling. Have you heard of it? It is a combination of using certain seeds during your menstrual cycle to help leverage your hormones to give you superpowers and make those period problems be gone. I'm Dr. Jolene Brighton, and we are chatting today all about seed cycling. I'm going to answer your questions, but first, let's catch everybody up on what is seed cycling. So, seed cycling is something that you can use a little food as medicine magic to optimize your hormones. Here's how we do it. We use seeds that are, so we use specifically flax seeds and pumpkin seeds during our follicular phase. And then we switch after we ovulate into the luteal phase. That's where we use sunflower seeds and sesame seeds. Now, they need to be raw, they need to be fresh ground. And when it comes to pumpkin and sunflower seeds, this is something where I will tell women, you can go ahead and use your teeth and you can use them as a grinder. That's not a problem to do. But with flax seeds and sesame seeds, that's a little bit trickier. So you are going to need to have those fresh ground. Now, in general, we eat 1 to 2 tablespoons of each of these seeds during the particular phase. Now, day 1 of your menstrual cycle, the first day you see blood, that's your follicular phase. That's when you'll jump into the pumpkin seeds and the flax seeds. If you follow my Instagram stories, then you saw my recipe that I put up today. If you're not, be sure to check those where I share a lot of the day-to-days of how I use food as medicine and my lifestyle practices to optimize my hormones. Day 1, first day you see blood, through ovulation, takes you through the follicular phase. Again, that's pumpkin seeds and flax seeds that we use. When we ovulate, that's when we switch over and we use sesame seeds and we use sunflower seeds. Again, they need to be raw. Now, one trick to make it easy is you can actually grind up both sets of seeds and put them in the freezer and store a week at a time. And so that way you can just dip in and grab a tablespoon or two every day. If you saw my breakfast today, I do 2 tablespoons of flax seeds, 2 tablespoons of pumpkin seeds, and then I also brought in chia seeds and hemp seeds along with some fresh berries. And that was my breakfast this morning. It was quite delicious. So, with seed cycling, one of the biggest questions I get is, when I seeds balance article, and you switch whenever you ovulate. So if you ovulate on day 11, go ahead and switch your seeds following ovulation. I see seed cycling can definitely help support your hormones. I would also recommend that you go to drbrighton.com and check out the article about early menopause. So I have an article about that, what some of the root causes are, and what you can do about it. So definitely see that resource. So, would a food processor work to grind the seeds? Yes, a food processor would work to grind the seeds. I use coffee grinder. You want it to be separate than your coffee. So you want to use just a regular old coffee grinder, but not grind other things in it. Otherwise, it'll make your seeds kind of funky. And then you can grind it up. Like I said, with the pumpkin seeds and the sunflower seeds, that's something that I'll tell women, put them in your mouth, you chew them well, like 30, 35 times. You're going to grind up those seeds. I see lots of lots of women joining now. If you're just joining us, we're talking about seed cycling. And yes, Stephanie, if you have a severe sesame allergy, skip it. So just go ahead and skip it and do 2 tablespoons of the sunflower seeds. So with that, if you guys have an allergy to any of these seeds, don't eat them. Go ahead and skip them. It's not worth the potential of having an allergic reaction. It's better just to skip those seeds. So, with seed cycling, I want to explain a little bit about how this works. So, why do we eat these particular seeds at this time of the month? And this is something I talk a lot about in my book, Beyond the Pill, is how to implement seed cycling. If you're trying to get pregnant, would seed cycling be helpful? Yes. Is it okay to do during and before a Dutch test? Yes. So this is not like a pharmaceutical. It's not going to intervene like a pharmaceutical would or really interfere with lab testing. And in fact, seed cycling can take a good 3 months to take effect. So with that in mind, you can go ahead and start it, have your lab testing done. It's not going to shift a whole lot. In fact, in my clinical practice, we have women start seed cycling and then we go ahead, they already get that started. We run the lab testing. That way they start to move things in the right direction while we wait for those labs to come, because seed cycling is not something that's going to push you further into a hormone imbalance. Now,
seed cycling, these seeds contain specific nutrients that help you build your hormones. And so if you read Beyond the Pill, then I recommend seed cycling at any stage in a woman's life. And in pregnancy, it's one where we want to eat those seeds freely and bring them in. If a woman does want a seed cycle while she's pregnant, she can follow the moon cycle. Same with being in menopause. If you're in menopause, you go with the moon cycle. On the new moon, we treat that like day one of your period, the follicular phase. The full moon is what we treat like ovulation. So then you would switch your seeds. And so you'll just cycle the way a woman would on a normal menstrual cycle, but instead you're going with the moon. Now, I've seen seed cycling do tremendous things. I've been seed cycling for well over a decade now. My mentor first taught me about seed cycling, and he actually published a book. I was in an interview, and they asked me who I learned seed cycling from. And there's several naturopathic instructors. When you're in naturopathic medical school, seed cycling is foundational in what you are learning. And so with that, there's a lot of instructors who taught me this, but one in particular published a book. And when I went and looked to see when his book was published, it was 20 years ago that he published a book including seed cycling. So that's pretty astounding. It's been around for a really long time. I'm not the originator or creator of seed cycling, or even, I think that seed cycling is something, it's very fundamental to naturopathic medicine, as is, eating and exercising and how you live along with your menstrual cycle. And I think it's also something too that we should acknowledge, that a lot of women who have periods have intuitively kind of landed on like, oh, I eat this during this part of my phase and I feel a lot better. And I think that's something that's really important to honor in yourself as well. And something I teach in Beyond the Pill is, how can you test foods and figure out which foods work for you and which foods don't work for you? So to use seed cycling, there's a few things you got to know before you get started. Maybe this is where I should have started this whole conversation. And that number one is that you've got to be tracking your menstrual cycle. You have to be tracking each day throughout the entire menstrual cycle, not just your period. That way you can understand when it's time to switch those seeds. Now, if you're not already starting to track your menstrual cycle, wait for your next period, record that, and then go ahead and continue to count throughout that. Now, the practice is really, really easy to do in terms of using 1 to 2 tablespoons of fresh ground seeds. However, it is a habit. So I don't want anyone to overthink this. I think it's really common that women, I see people out there talking about seed cycling. They're like, you have to do it exactly right every single day. And if you don't, like, it's not going to work. And it's like, when you're getting started, there's going to be a little bit of touch and go. But like we just had somebody say, they are allergic to sesame seeds. I've had patients allergic to sesame seeds, intolerant of flax seeds. So like women with SIBO, and they still get the benefits and we still see the effects of that. So sorry, Instagram, I'm having poor connection. I just shut off my Wi-Fi. Hopefully that helps. Sorry, guys. So with that, I do want to say that like this is food. If you don't get it right every single day, please don't stress about it. And in addition to that, if you are someone who has an allergy to one of these seeds, go ahead and skip it. I've definitely had times where I'm just cycling with flaxseed at the beginning of the month. I don't have any pumpkin seeds on hand, and I still see benefits to that. So I just don't want anybody creating more stress on themselves. So another common question that we get is that about flax seeds and estrogen. You took the period quiz with elevated estrogen and prostaglandins. I'm already taking balance, but do you think that the period problems kit could correct this? So if the root cause of what is going on, so if you've elevated prostaglandins, I have an article about that on drbrighton.com, and that's where I typically will use things, and you'll read this in the article, like Magnesium Plus. So my Magnesium Plus and my Omega Plus, because that can help shift prostaglandins. Looking at, full estrogen metabolism, we want to, so balance can definitely help with that. But if you're not pooping every day or you got the wrong kind of gut bugs, you may need a probiotic to help you move that estrogen out. And then, of course, if the issues with your estrogen is because you're making cortisol over progesterone, then bringing in something like adrenal support can really help nourish those adrenal glands. So what if you are, and why I answer this question is because what if you are estrogen dominant? Should you skip the flax seeds? If you guys caught yesterday's video talking about xenoestrogens, I'm rocking my metal straw. Okay, so fresh ground flax seeds. Now, this is where it gets confusing. Is that there is research showing that flaxseed oil is estrogenic and it can be problematic. And some of the most notable studies are the ones on prostate cancer. And why? Because prostate cancer is if men have excess estrogen, it can make that a whole lot worse. And what they found is that supplementing with flax oil does make it worse. Flax oil is estrogenic. This is I don't recommend flax oil unless like you know the source, you know it's not being oxidized. You have to be really picky about it. Now, with that, flax seeds contain lignans and they have fiber. So they actually help you move out estrogen. So they're one of those perfect foods that help you raise estrogen while simultaneously moving it out. So it helps keep it in balance. And then when we're eating it with seed cycling is in the follicular phase. That is when estrogen should be the main diva on the stage. I just did a podcast not too long ago and I was like, she's like the Beyonce. That's Beyonce's time to be on stage. Should you stop taking hormone replacement therapy and follow your instructions to get out of early menopause? No. So if your doctor prescribed you a medication, then you should follow what your doctor recommended. And then you should have a conversation with them if you want to discontinue the medication. It's something that's really, really important. Nobody on the internet can advise you about medications. That needs to happen in a doctor-patient relationship. And as of right now, I am not accepting new patients, Heather, but I would recommend that you check out Beyond the Pill. And if you're wanting period support and you've never been on hormonal birth control, you want to check out my period problem solution course. So that's an entire course that takes you through seed cycling, takes you through the nuances of how to eat, move, think, and and really the mind body connection throughout your period. So something that I do that's a little unique compared to other practitioners that are out there is that I call it cycle self care, and it's where you are looking at not just how you eat and not just how you move during your menstrual cycle, but I have protocols around mantras, meditations, self-care practices. And so all these through being a naturopathic physician, through being attuned to Reiki, through being a yoga instructor and all these things I've done in my life that I pulled together and worked with patients on. And all of that lives in my period problems solution course. So you can check that out. Now I see we have a question on YouTube. Is hormone imbalance or hormone balance possible after many years of misdiagnosed and untreated PCOS? Yes, Mrs. G. So many women with PCOS, they don't get diagnosed for a while. Things are getting better, but with historically, it's been a long time of, not knowing when your period's coming, having acne, all these kinds of things, being past birth control, and nobody asking why you had those symptoms to begin with. And so, yes, it is possible by addressing with PCOS. And I have a whole article I have a lot of articles on PCOS actually on my website drbrighton.com, talking about getting to the inflammation, the insulin resistance, what the root cause of PCOS is. So, everyone who's joining us, we are talking about seed cycling. If you missed the beginning of this, rewind, go watch it. As soon as this ends, you will be able to watch the video on YouTube and get the lowdown on seed cycling. Now, the nice things about seed cycling is that I've seen it be able to help women with breast tenderness. It's helped women. I had a patient, I've had many patients go on to have healthy pregnancies after I was struggling with fertility. Now, this isn't to say that seed cycling is a cure all for everything hormone related. It's an adjunct therapy that we bring in. So it's another tool that we leverage to move the body into balance. And seed cycling can help with optimizing your periods by way of lowering the prostaglandins, so we have less painful periods. It can also help with PCOS symptoms. So, Mrs. G, seed cycling is something that can help with PCOS. I've seen it help regulate cycles in women, and it can certainly help with acne as well. And so, acne can be due to a number of issues like excess testosterone, estrogen dominance, poor gut health, inefficient liver detoxification, lack of quality nutrients in the diet. So, acne is truthfully usually multifactorial. But it's also common when women come off of hormonal birth control. As you read about in Beyond the Pill, that's due to the androgen rebound. and we see an increase in testosterone production. And so that's why I recommend seed cycling when women come off of hormonal birth control, because it can help nourish your gut. It will supply you with zinc, which is one of the nutrients that is depleted by hormonal birth control, that can also help balance testosterone, and it's going to help your body move the estrogen out. And so this is just like, I mean, I could talk all day about how awesome seed cycling is. And I see some of you saying that yes, you've read about it in Beyond the Pill. And so, if you haven't seen, these all live on YouTube right now. We went through chapter by chapter in a virtual book club. We ended with chapter 13, which is non-hormonal birth control options. And then what is left is going into the recipes. And so with the recipes, I should have done this before I jumped on here, but I just thought of it because you guys are talking about seed cycling and how you started it because of Beyond the Pill. So with the seed cycling, I talk all about how to do that in Beyond the Pill. And then there are recipes. So like the no-bake sunflower cookies, the sunflower rose cookies. So those sunflower seeds are going to be luteal phase. I actually wanted to call them luteal phase cookies. And everybody's like, shut it down. That's not cool. And then we have the flax and pumpkin balls, which are estrogen balancing balls. When I say everybody shut it down, I mean, my editors were like, that's not a great name for a recipe. And I'm like, really? Luteal phase cookies? I thought it was. So there's a couple recipes in here so that you're not just like being like, seed cycling means I got to eat a smoothie every day. Like, yeah, you can do that. But there's also lots of ways to incorporate seeds. So I've seen an increase in bowel movements in seed cycling. Is that normal? 100% normal. And so, yeah, as you increase your fiber intake, you're going to bulk the stool, and then that's going to help you be more effective in moving things out. And Mrs. G, you're totally welcome. Thank you for your question. And thank you for saying thank you. So I'm curious from you guys, how long have you been practicing seed cycling? What things have you experienced from it? I see that we've got sorry, it's going too fast. Madga 86 is saying 3 months she's been, or 3 weeks she's been seed cycling. The video froze when I was saying my thoughts on flax oil. I can repeat and know that you can always go over to my YouTube channel. If you're not subscribed there, please do that. That way you don't miss out on videos when I go live. And you can always go check them out after the fact. So with flax oil, flax oil itself can be estrogenic, pro-estrogenic, and if it's oxidized, that can be very problematic for our overall health. And there have been studies to show that flax oil can actually make prostate cancer worse in men. So yes, we're talking about male parts, but they are affected by the estrogen, where they found that the flax seeds, the whole flax seeds, were actually really beneficial, and they didn't have the same effects. So that's why you don't use flax oil for seed cycling. If you are going to use an oil, you're actually going to use fish oil. So like my Omega Plus is what you would use in place of flaxseed and the pumpkin seeds at that point. I see Jess Robbie is saying 4 days of seed cycling, but you missed a day. So it's been like 3. That's okay. If you miss a day of seed cycling, just forgive yourself and try again the next day. It's not going to be the end of the world. Again, this is a habit that we're forming. And people do a lot better when they're forming habits, when they give themselves permission to fail sometimes, because it happens. And that, like, they forgive themselves, they move on, they try again the next day. When we fall out of habits is when we get really dogmatic about it. Now, there's a lot of reasons why we fall out of habits, but one big one is that you get really hard on yourself. Like, people are like, oh, I was on this diet and I was not supposed to eat sugar, but I had a bite of cake. So forget it. I'll just eat the whole cake. Like, have you ever been there? Have you ever been there? I'm putting my hand up. I've totally been there. So with that, be gentle with yourself. It lowers inflammation, and just know that, like, you're human and things happen. Like, sometimes I'm traveling and I'm like, oh, snap. I totally forgot, like, my seeds. And you guys know, if you were with me yesterday, I try never to forget my balance supplement, because we were talking about how bad your boobs can hurt during your cycle. The sun is really sunshiny, shiny in Portland right now, but this is what I'm talking about, the balance supplement. Whoops, sorry with my camera there. But this is like, I can't, I keep it in my office, you guys, so that, like, I don't forget to take it. And somebody was asking the other day, they were like, what if I forget to take the second dose? I'm like, take it with you. It's in my office right now. That's my own stash. Can evening primrose oil replace cycling in the luteal phase? Yes. So if you cannot, so let's say you're on an autoimmune paleo diet, autoimmune protocol, and you can't have seeds right now, you haven't introduced them, cycle with the oil. So you'll use the omega plus during days 1 through 14. You'll switch over to an evening primrose oil or a high GLA oil during days 15 through 28. Is that better or a replacement for seed cycling? Not really, because that's just the oils and you're missing out on all the phytonutrients and all of the minerals that you get as well. But if it's what you got to do right now, totally fine. And if I have women with really bad period problems, we will actually combine the oil cycling with the seed cycling to get them out of that as quick as possible. Is seed cycling good for people with endometriosis? Heck yes. That also have SIBO, Candida, and coming off of birth control. So yes, yes, and yes. The caveat to SIBO is that I don't generally bring in flaxseed with women with SIBO until we've cleared it. But some of my patients are like, I want to try it and I want to test it, and they'll do fine. But I would never say in a general statement that, oh, people with SIBO, go ahead and do the flax seeds. Because for some people, and with SIBO, some people can eat FODMAP foods and like they can have apples or they can have onions and garlic and they're fine. But if they have an avocado, they feel like they're going to die. Like, and so it's not universal, like the fermentable fibers that come in, what they will actually, what they will do in your system if you have SIBO. So you may want to test it. That if you're like, I have pretty bad SIBO, I don't even want to test it. Eat the pumpkin seeds, eat 2 tablespoons of pumpkin seeds during the follicular phase, then go into the luteal phase. And actually, I will say this, that while I'm treating SIBO, when I'm treating the organisms, which I have we should do a whole thing on SIBO because I have a very different approach than most people. But with that, I actually encourage women to feed them so that you can kill them. Dr. Mark Pimentel is the one that's like, he's found that if you starve them while you try to kill them, they just kind of like hibernate and then they come back. So sometimes I will bring in flaxseed, psyllium husk, things like that with women, or I'll just be like, eat whatever you want, except for things that you might be sensitive to. I do all 4 pills of balance in one dose instead of 2. You can, the thing that why we separate the dose is for absorption. So that, but there's not like super high doses of things in there that would impede absorption. If it is like, if it's a day where you're like, okay, look, like I got a lot of running around to do, because that totally happens to me. I'll just pop 4 in the morning, call it a day, and keep on moving. Like if I know I'm going to be traveling and I'm like, I don't know what's going to happen when I land. Am I going to get that second dose? I just take 4 all at once. I try not to make it a practice though. It's not the end of the world if you do that. And if you feel great and you're taking 4 at a time, then I mean, totally fine. But really, we want to optimize absorption by spacing things out. Yes. So Ahmad dot soror. That's your Instagram handle. With PCOS and no periods, will seed cycling help? Seed cycling can definitely help. Go check out the article at drbrayton.com about seed cycling for hormone balance. And I talk a lot about that. And I talk about PCOS in particular. Yes. So I actually had this patient, and a lot of the period problem solution course is it came from, the whole inception was like this case that I had. And then I started testing it on other women and building out this protocol. But she was doing everything right. She was exercising, she was eating well, like everything was going well, but she could not get pregnant and she had PCOS. And I started her on seed cycling and then sent her out for lab testing. Her labs didn't come back and she didn't come back. And I was like, girl, what happened? I call her up and she's like, oh, I got pregnant. So I went to my gynecologist. I went to my OB instead of following up with you. And I was like, okay, that's the right move. If you get pregnant, you should go to your OB. But I also would have liked to know. And I'm like, wait, what did you change? And she's like, seed cycling. She'd been seed cycling. That was the one thing that she changed, and she got pregnant. And that, I thought that moment was like, it was early in my clinical practice where I was like, oh my God, this is like even more magical than my instructors told me it was magical. But then I was like, yeah, no, I don't know about that, because I'm always very skeptical. And then my patients really demonstrated to me like what is possible. And I built the period problem solution course for women who have never been on hormonal birth control because they're out there. They're a little bit of unicorns, but they're out there for them to have a solution so that they can start to optimize their hormones and work with their period as well, not just hear a whole lot about birth control. So SJ Hen, I hope that answers your question. In terms of candida and eating these seeds, there's no contraindication to that. And if you have SIBO and you have candida and you've been on hormonal birth control, you will not heal SIBO and candida until that hormonal birth control has been taken out of the system. I hate to say that, but that's the real talk. And it's only because we know from the research that hormonal birth control leaves you predisposed to having yeast overgrowth from the mouth all the way through to the anus and in the vagina too. And so it causes microbial imbalances. It also impacts the gallbladder and it can impact motility indirectly. There's a lot of things it does. I'm actually in an upcoming documentary all about SIBO talking about this and talking about this connection because it's that important. And it's always the thing I see patients come to me and they're like, oh, I've treated my SIBO like this many times with rifaximin. And I'm like, why hasn't anyone talked to you about the pill and what birth control is doing? Or why isn't anyone talking to you about your thyroid or your other hormones? Like your hormones are involved with your gut and vice versa. You can't just myoptically fix one thing and think like, oh, I'll just fix my gut and then everything else will be fine. A lot of fine tuning that has to be done there. Is it necessary to activate seeds for best absorption? I don't know what you mean by activate. Maybe you mean soaking, and the answer is no. So you can just fresh grind them up. Like I said, you can put a week's worth in your freezer and then just take a tablespoon at a time. So they can go into smoothies. They can go on top of oatmeal. If you saw my recipe today, that's just a bunch of seeds. And I usually I didn't have any psyllium husk, but I'll throw like psyllium husk in there as well. It feeds the microbiome really well and it optimizes your hormones. Then bringing in those berries or bringing in bioflavonoids and phytonutrients that are antioxidants, they protect my ovaries. Yay! Which means that my periods will be easier and not like total chaos, right? SJ Hen, if you haven't grabbed Beyond the Pill and you're working on getting off the pill, definitely check out this resource. It's the only book out there that really details hormonal birth control and gives you protocols to really get dialed in on each of the ways that hormonal birth control impacts you. And if you're working on getting off of it, but you're on it right now and you're in gut troubles, definitely check out my gut check chapter around that. You haven't had a period in 4 years since stopping birth control, low estrogen, low FSH, and my doctor suggested to try progesterone for 10 days while I wait to do an MRI. I'm nervous. It's like a band-aid. Shelby, sometimes you can use progesterone, withdraw it, and you can start the system again. I call it like little jumper cables. I don't like to start with bioidenticals to begin with, but sometimes that can help. And your doctor may have a concern of endometrial hyperplasia, which is that the lining of your uterus is getting too thick. And if that's the case, then we can end up with big time trouble. So they may be wanting to simulate a withdrawal bleed in that way. So but you can start seed cycling. If you are waiting for an MRI, you can start seed cycling. If you are, you're going to use progesterone bioidentical, you can start seed cycling. And of course, when in doubt, talk to your doctor. But what we're talking about is we're just talking about bringing in foods and not such high dose foods that we could be shifting into a problem. So keep that in mind. If food is a medicine, food can also be toxic, right? If you're doing too much of a good thing. Like if you're going and eating boatloads of oysters, you're probably going to have a little bit too much zinc and your copper is going to be struggling. And so we have to keep in mind, while people will say, well, it's natural, so it's safe. It's like, not always. And also like if you are eating like way too much flaxseed, you can actually start to create other problems in your system. What's way too much flaxseed? Like if you're eating cups of ground flaxseed. You love that my shirt matches my book. I know, kind of cool, huh? I put this shirt on today, and then I was doing an interview and I saw that too. And I like that you picked that up. That's kind of funny. Is it okay to do flaxseed throughout the entire cycle? I find I don't have a regular of BM without daily flax. So if you aren't having regular bowel movements without flaxseed, look at like varying your fibers as well. In general, we don't want to eat the same things every day for a long period of time. That's how we can develop food sensitivities. And so with that, you might want to try like when you switch into the luteal phase and you're coming out of the flax seeds, I'm like, I just want to get it out and say psyllium husk. But I'm like trying to explain it that way. So when you're going in the luteal phase, maybe you bring in some psyllium husk. Maybe change the diet. So now you're starting to eat, more fibrous vegetables. So eating the celery rather than juicing the celery, so you actually get the fiber in that. Bringing in apples can be beneficial. Making sure like you've got like avocados in, and Jerusalem artichoke can be really helpful. Just eating artichoke hearts. And so varying the fiber as well. And if you need a little something extra, bringing in a little bit of psyllium husk, it doesn't have to be a whole lot. We want to vary the fibers that we're showing our microbiome. We don't know enough about the microbiome to be like, just eat this fiber and it will feed these bugs. That was like not how like we grew up in the world as animals, right? And so we want to vary our fibers. And one way that you can vary your fibers is actually eating seasonal as well. How can you bring your period back? It all depends on why you lost your period to begin with. So if you go to drbrighton.com, I have articles about missing period. If it's because of birth control, you want to check out Beyond the Pill and my birth control hormone reset program. If your period's been gone missing altogether and you haven't gone to a doctor, that is definitely step one, because there are some big scary things that can be going on that cause us to lose our period. That's why your period is so important, and paying attention to it is super, super important. But it is most of the time it's not big scary things. But my job is to educate y'all in staying safe. So, Jennifer, I think you missed the beginning of this. At drbrighton.com, you can definitely learn more about seed cycling. But Jennifer's question is, what if you don't have a period and you don't know where you're at? You go with the moon. Pregnant women, menopausal women, and women who don't have a period, amenorrhea, you follow the moon cycle. On the new moon, that's where we consider the bleed. So that's follicular phase. And then the full moon is when we roll into our ovulatory phase, and we follow the moon cycle. If you don't know, you cycle with your menstrual, or your menstrual cycle cycles with the moon in most women. And so just follow the moon cycle. When your period comes back, just switch to whatever your period is doing, what your body is doing. Your body knows better than your mind knows, trying to be like, here's my limited knowledge and understanding of the female body. Let me try to make it work that way. Roll with your body. Support your body when your period comes back. Mass and anxiety. Yes. Yes. So when we look at PMS, why do we get PMS? Estrogen dominance, low progesterone, too much catecholamines, imbalances in neurotransmitters. And what really all of that comes down to is making sure we optimize gut health, which seed cycling can help with. Now, the other thing about seed cycling, it will help you have estrogen at the right time, clear estrogen appropriately, and then help you have progesterone at the right time. So that way you're getting your progesterone up. Why do most of us get anxiety? Because progesterone goes low. And you guys, if you've been following me for a while, you know I shared when my dog died abruptly. I had the worst period of my, not of my life. I want to be all drama about it. Well, like not of my life, but my dog died abruptly. That happened like right after I ovulated, and as such, because I was under so much, if you guys ever saw me with my animals, like and I keep chickens, and when my chicken dies, I'm like just face down in the grass, like bawling my eyes out. So I'm mad, stressed out, like crazy bananas stressed out about losing my dog. My corpus luteum is like, shut down the progesterone. And as such, what happened next is that like a few days before my period, I think it was like 5 days before my period, I started like running the thoughts that us gals like to do. What didn't I do right today? And oh my God, I said this thing, and should I have said this thing? And I don't know. And my brain's like, let me just talk to you while you try to go to sleep. And the body's like, yo, I got to go to sleep. Like, why are you talking to me? And like, that's what happened. Progesterone got low. Thoughts started going. Here came the anxiety. Sure enough, here came the super painful periods. And if you guys follow me for a while, then you saw me on my Instagram stories. I got on and I was like hugging a hot water bottle, showing you guys, taking my cramp bark, taking my magnesium, and just like on the verge of vomiting because it hurts so, so bad. And that is somebody that like I was doing all the things, right? But that was really the impact of stress. And then I showed you guys like how long it took for me to be out of pain. Which my husband's like, you're crazy. Like nobody in the hormone space would admit that they ever have hormone problems, because people people are like, I'm a hormone expert, therefore I have perfect hormones all the time. And I'm like, I am a woman living in a crazy world, and sometimes things get crazy, and that's the way it goes. And I think it's better that we all share our real story instead of perpetuating these ideals, and that like we express like what can happen with a period. So that's my period story. One of my many period stories. I bet you have a bunch too. Mrs. G, you just got the book on Audible. So excited to start listening. Did you just get it right now during our live? I'm curious. I heard you mentioned on Dr. G podcast that there's only a day where one can get pregnant. Can you touch on that? Yeah, totally. And if you've missed the Beyond the Pill book, the virtual book club that we did, you'll want to check the chapter 4 for sure. Actually, you want to check Lowdown on Your Periods, chapter 2, chapter 4, and then the fertility chapter as well. You ovulate, you got one day, one 24-hour event. That egg will live for only a day. Some of us, it might live 36 hours, but for the most part, it lives a day. You, as a woman, are only fertile for one day. However, the fertile window is expanded to almost a week because that sperm be tricky and sperm will stick around and it will live. And so what that means is that during your menstrual cycle, libido upticks, you have sex, you capture some sperm, here comes the egg several days later. So that's why I really encourage people, if you want to use fertility awareness method, working with a FAM educator can be super, super valuable to understanding the ins and outs of this. So early menopause, trying to get my period back. How do I do seed cycling? That was at the beginning. Go ahead and you want to rewind, watch all of this. We went through the principles of seed cycling, and I've mentioned it several times, which is why I'm not going to go over it again. But there's a couple articles at drbrighton.com. There's seed cycling for balancing your hormones, and there's seed cycling for perimenopause and menopausal women. So go check that out. Is rosacea a symptom of hormone imbalance? Can definitely be. If so, what do you recommend? Starting seed cycling at the new moon. Woo! Get that seed cycling on. With rosacea, there usually is an estrogen component. So checking out where your estrogen is at, using the principles that you'll find in Beyond the Pill to optimize your estrogen levels altogether. I see the questions coming through about parasitic cleanses and gut and all of that. And today we're talking about seed cycling. So I'm kind of keeping it on track with that. I'm not ignoring you. That's just a conversation for a different video for a different day. All right. So, okay, I see that. I'm just looking through questions here. Infrared saunas and frying your eggs. I have not heard of infrared sauna actually causing damage to your ovaries. So I would have to research that and look into it a whole lot more. So that I don't know that infrared saunas will actually fry your ovaries, fry your eggs, as you were saying. I would be a lot more concerned about putting a laptop on your lap or carrying a cell phone in your pocket or in a purse next to your pelvis. I'd be more concerned about that than infrared sauna specifically. And it also depends on why you're using the infrared sauna. Could the pituitary growth be the cause of my missing periods? Yeah, Gabby. So that's a great question. So if you have a tumor called a prolactinoma, it's a pituitary tumor, it will secrete prolactin. That's why it's called prolactinoma. Prolactin should be high in women who are breastfeeding, but it'll be high in this circumstance. They've actually changed the guidelines that it used to be you had to have multiple readings of high prolactin in your blood. If you have one high reading of prolactin, then we send you for an MRI. That's the best way to rule out a prolactinoma. If you have a prolactinoma, it will shut down your menstrual cycle the same way that prolactin shuts down a menstrual cycle in a woman who is breastfeeding. So whenever there's a missing period, I do, and you have these labs in Beyond the Pill. I give you 6 tests for a missing period. One of those is looking at those pituitary hormones, FSH and LH. And then, yes, getting an MRI is always a good idea to see what's going on with your brain. Prolactinomas are benign, but they can grow and they can affect your vision. And so this is why it's very, very important to always be working with a licensed healthcare provider. I love me some nutritionists, health coaches. I used to be a clinical nutritionist. Love them, but they are adjunct therapy to something like a brain tumor. So just want to be like really clear about that. And I hope that helps. Because I recently had, I actually had several comments come through of women commenting on like how difficult it is to navigate the healthcare system in the United States and understand who to see for what and who's actually a licensed healthcare provider, which I think is ridiculous that. And you're right. Like these women are not wrong. They're right. It is very confusing. I think it's ridiculous, though, that we can, as consumers, as patients, easily tell if somebody's a licensed healthcare provider or not. But no, based on their credentials, there are databases that you can check out to see if they're licensed. What does it mean to be a licensed healthcare professional? It means you went to an accredited college. It means that you have taken board examinations. So you've had to pass rigorous testing to be able to hold a license. If you hold a license, you have to do continuing medical education, which also includes ethics, which is very, very important in medicine. And you also have a board that governs you and oversees you. And so it's a lot of layers of consumer protection. If they are not a licensed healthcare provider, they don't have those layers of consumer protection. And so, and that's not to say that like they're a bad provider or wrong provider. It just means that their scope is totally different. So, like in the realm of talking about hormonal birth control, only a licensed healthcare provider with the license to prescribe birth control can be making recommendations to you surrounding birth control. Same with like any kind of medications, testing, things like that. But I just like to be really clear. It doesn't mean that because like you're working with a health coach that like that's somebody you should just discard. They have a time and a place. They are great at helping you take the habits that doctors are wanting you to make and actually make them real habits. So I hope that that little bit is helpful. That's been a really common question coming through. So I just wanted to make sure that I touch on that. Why is Toso testing so expensive? Like the Dutch, 400 for one test. Janelle, have you ever seen what's on a Dutch test? Definitely check out the information you get on the Dutch test. To do the same number of tests that are on the Dutch test, if we were going to do blood work, like that's thousands of dollars. So with Dutch testing, part of why it's expensive is because you have to use reagents. So there's a lot of what happens behind the scenes in the lab is they have to use all these chemical reagents. Those are not cheap. And so what it takes to get the lab results and the data and the testing, that a lot of patients say to me like, whoa, this is so expensive. Then when they get the results, they're like, oh my God, this is so worth it. And definitely, if you grab Beyond the Pill, go to beyondthepillbook.com. You can grab some gratitude gifts, order your own lab testing, and it's a little bit cheaper to get the Dutch test through there. So go ahead and check that out. And that's the tricky thing. It's like, when we go to run, some of these tests, it's like, why is this so expensive? Because there are lab costs. Now, when it comes to like, why is blood work so expensive? Thank you, insurance companies, for making everything so much more expensive in the United States. I'll leave it at that. Is it possible that my tumor just disappeared, or more likely that it's a false read? I don't know, Gabby. Like that would just depend. Like I said, it wasn't there on the second MRI. Well, it could be a false read. It could be lots of things going on with that. You might want to get a second opinion of that. Which are the best supplements for PCOS? I have a whole article on that at drbrighton.com. So it's actually PCOS supplements, the best supplements for PCOS. And I talk about in that article, I give you like a rundown of like, here's the top 10 that are really great. There's definitely more that I could have added in, but like it gets a little overwhelming. And then at the bottom, I'm like, here, if you're feeling overwhelmed, here's where to start. And I have a PCOS kit at drbrighton.com that you can check out. It's a combination of adrenal support and saw palmetto plus and balance that all helps optimize testosterone so that we can say bye-bye to back knee and hirsutism and some of those issues that we see come up with PCOS. So these are really, really great questions. Chelsea, you're enjoying Beyond the Pill. That's awesome. I'm so glad to hear that. I love seeing your guys' recipes come up. I just recorded with somebody today, the superfood, or the she is superfood alchemy on Instagram, and we were talking about food porn. I outed myself. I'm like, I don't watch porn, but like you show me food porn and I am there. I'm like all over that. Not to shame or judge anybody who does watch porn. That's just not, I'm like, not my jam. I'd rather look at food. Do I help women with endometriosis? Yes, that's covered in Beyond the Pill. And I've got several articles at drbrighton.com that you can check out for that. Feeling crazy in your body. Yeah, you're in perimenopause, no period this month, girl. That's how it feels to be in perimenopause when things are imbalanced. Definitely check out Beyond the Pill. You want to see the gut chapter, liver chapter, adrenal, and thyroid chapter. Check those chapters out. That's going to help so much so that you don't have to be in the chaos of perimenopause. So high DHEAS might indicate you've had hirsutism for 8 years. It could be adrenal stress. It could be a sign of PCOS. It can be several things. So working with a clinician and working that up further is definitely a good idea. Um, when do Depo-Provera side effects go away? I feel anxious all the time. I never had these issues before. I'm so sorry. Depo's going to take you a good 3 months to clear your system. And even then, there can be post-birth control syndrome where just because we stop the hormonal birth control doesn't mean the symptoms go away. So definitely, I encourage you go to the mood chapter of Beyond the Pill, where I do have some short-term anxiety solutions and some long-term anxiety solutions. What about a chapter of getting out of early menopause? Take a look at chapter 4, the Take Back Your Period chapter. That's the one. You love the podcast with Dr. G. That was fun, right? I really did love that podcast. And I haven't checked if it's on YouTube. What I love though is there's a point where I was like getting all like upset about something like I do, where I'm just like, that's my little Latina self being like, I can't even believe this. I was like taking off my clothes. I had to take off my jacket. What you didn't see is that we were in a little tiny room recording. It was kind of warm in there. But yeah, I thought it was a great podcast. Main chapters for acne. We talk a lot. There's a whole acne protocol in the post-birth control syndrome chapter. And you definitely want to check out YouTube. There's an entire series of Beyond the Pill. We went through a virtual book club. Every single chapter we went through, it's up there. Just Robbie, you're going to miss these live chats. Am I leaving? What's happening? Why are you crying? Why am I getting crying emojis there? I am going to leave for now because I got to go make dinner for my family. What day of my cycle do I test my blood? Can't find it in the book. Really? You can't find it? It talks clearly about day 3, FSH, LH, estradiol, and then progesterone being the day 21 or using the Dutch test. And it says it in the book. And if I didn't have to run and wasn't getting like the countdown timer, I would like pull it out and show you that. Yeah. So you guys, thanks so much for being here. I hope this information about seed cycling was helpful for you. I do talk about seed cycling and Beyond the Pill. So if you've grabbed a copy though, go to beyondthepillbook.com, get your gratitude bonuses there. And then certainly if you're wanting a little more hand-holding and a little more support, the Period Problem Solution is a great accompanying program to the book that you can go ahead and check out. We do talk about seed cycling in there, along with, and if you missed the beginning in the Period Problem Solution, we talk about not only seed cycling, how to eat throughout your menstrual cycle and how to exercise, but we also go into mind body practices. Again, having been a meditation and yoga instructor, we're bringing in mantras, we're bringing in, different practices and really working on the energetics of being a woman and bringing that into the cycle self-care overall. So I hope this was very helpful for you, and I will see you guys next time I am live.